morning. And we are happy, blessed, and privileged to have a topic, positive mindset, dealing with diagnosis of prostate cancer. Yes, you heard me correctly. We are going to share about cancer of the prostate. Thank you so much, Team Purposeful Aging, for the information you've just been displaying on the screen. Those slides were very important, and I hope you have taken a close look at them. In particular, the first slide showed us how common the prostate is. To remind you, it ranked as the first or the commonest cancer in men. And when you take both men and women, cancers in both men and women, it ranked as the fourth cancer in both sexes. Many of us present online this morning can name a brother, a father, an uncle, a husband, or a friend, neighbor who has been in this situation of having the diagnosis of cancer of the prostate. So Purposeful Aging therefore thought that sharing all about the diagnosis of cancer of the prostate will be a very useful thing to all of us as we age, and all of us as we actually receive that diagnosis of cancer of the prostate. Many of the caregivers are usually women. They don't necessarily have the prostate as such, but they get affected. Our facilitator this morning will take us through the period before and the period after one has got the diagnosis of cancer. I'll do a little bit of housekeeping. As always, you are invited to share openly anytime in the chat, and by directly raising your virtual hand, or take part in the Q&A at the end of the presentation. I will also encourage those of you in the medical field to really take part this morning, since our presenter is not a doctor, is not a medical person, but is a counselor who will be able to fill in the gaps where many times the medical people actually leave untouched. So, as a way of introducing our guest, we are very privileged this morning to have Reverend Benjamin M. Kakonge. He's a family man, married to Mary. He has 4 children, and all of these children are living with him in the USA. He's also a proud grandfather of 2 girls. He was born and raised in a humble Christian family back here in Uganda. We are very greatly honored to have you, Reverend Kakonge, to share with us this morning. Reverend Kakonge, education background is wide.
Okay, good morning, everyone. Let us pray.
His education journey is characterized by what I'll call never give up spirit. He holds a master's degree in psychology, Makerere University, and a BA in social sciences, Makerere University. He holds a diploma in education. He holds several certificates, one in journalism, another in small scale business, another in project planning and development, and one in counseling. And the most important one to his later life is a certificate in theology. A few years back, he moved out of Uganda and is happily living in USA, where he was licensed to carry out social work activities in the state of Virginia, USA. His work experience stretches from many years of being a teacher in various schools in Uganda. He has been a priest in Namirembe Diocese and was posted in several locations in the Diocese of Namirembe. He actually rose to the rank of heading the education, being the diocesan education officer at Namirembe. He worked at TASO, well known to many of us, as a social support coordinator for orphans and vulnerable children. He worked as a contributor to Luganda newspapers like Ngabo and Bukedde for many years. And he worked as a director orphans for a project named Medicine du Monde in Chotera. He then moved to the USA, where he worked as a counselor, and now he's retired and has embarked on an uphill task of teaching Luganda language and culture to children born in the diaspora. As it were, he has gone full circle back to holding Luganda church services for the small Ugandan community where he lives. That community owes its allegiance to Church of Uganda. That's why he's back in Church of Uganda as a priest. Personally, he has a passion for the Lord Jesus. He loves counseling, especially the youth. And he loves helping people who have migrated to the US to help them settle down. He loves reading books, especially those of African writers. And lastly, one of his last passion is listening to music. Participants have taken a bit of time trying to introduce the facilitator, just to make sure that you put each and every slot I've talked about into what he's going to talk to us about. Reverend Kakonge, you are most welcome. Thank you so much for accepting to talk to us about cancer of the prostate. We have over 29 participants online. Some of them are medical people and others are caregivers, not necessarily medically trained. You're most welcome, and you have 45 minutes to talk to us. In case any of us has something hot and interesting, usually we accommodate each other during those 45 minutes. Thank you very much for coming, and the floor is yours now.
Thank you very much, Dr. Christine. I hope I'm heard by everybody.
Yes, we can hear you. We can hear you.
First of all, I've been humbled by the way you introduced me. I felt elevated from where I am. But above all, I want to say that I've been not attending these meetings as I'm doing now, not because I don't want, but because of time difference. And since I'm a grandparent, when I put on this kind of noise, the kids, my grandkids will come out and say, "Hey, Papa, what are you saying?" So I end up listening to the audio sent to me. But thank you for that spirit. To begin with, about this topic of prostate cancer, I'm going to talk from a layman's point of view. And two, I'm going to talk as a person who has personally experienced this disease, and how I've been able to cope with it up to now. How did I come to know that I have prostate cancer? When I came to the States, or before that, in my years, when I was growing up, we never had medical exams or annual or biannual or quarterly medical exams. We never had them. We're only taken to hospitals when we fell sick.
Yes, yes, yes.
And I grew up with that I only go to hospital when I fall sick. Even if when I got educated with all the education you had, I have acquired, nothing passed into my mind having an annual medical exam. Either it was because of ignorance or I never took it seriously, but that is how it was. But when I came to the States, and after exchanging, talking, and listening to people I was engaging with, I found out that here people take medical examination, thorough medical examination very seriously. So I decided, I think one day, I'll just go and have one. But I couldn't do it here. Why? Because when you come here, you don't have insurance. You cannot be able to go to, you can go, but the bill would be too high. So I decided to be doing my exams in Uganda whenever I go back to Uganda. And I was using Kadik Hospital. By that time, it was in Bukoto, to do my annual medical exam whenever I could come to Uganda. By this time, in 2017, I went to my sister, who now happens to be the principal of Mulago Nursing School. And I said, I want to go to Kadik to do some medical exam. He said, no, why don't you come here? I'll help you to do it here in Mulago. Don't spend that money there. And then he made an appointment. She made an appointment. And I was able to go for that appointment. But the appointment was not on prostate. I want to be clear on that. I had a problem with my stomach for the last more than 7 years or 10 years. It was bothering me a lot. So I said, no, then you come here. We'll do more tests to find what exactly you are suffering from. So as I was waiting in the line, something popped up into my mind. He said, I'm hearing people talking about this prostate cancer. Why can't I do it? I talked to her. Say, no. Let me go and see the doctor so that he can put it on. He went. The doctor put it on to do that kind of to know my PSA, which I never knew by that time. I just had the word PSA. Then when it was done, my sister had gone back to the nursing school. I got the results. They told me my PSA was 19. For me, I didn't know what 19 meant. I don't know what 19 meant. I just went to her. When she looked at 19, said, that's how she calls me. No, you must go for further exams. I said, no. I said, yeah, this is serious. I said, okay. And my body, I never thought that was as serious as he thought. But I called one of my friends, who happens to be Dr. Christina, and informed her. Say, no, Reverend. No, you must go and do ABCDE. So I went to Namirembe Hospital, not on Wellington Road. There's an imaging center there. Oh, just to go back. I went to Dr. Watia. I was talking to go to Dr. Watia. Dr. Christine made an appointment for me. I saw Dr. Watia. Dr. Watia sent me to the imaging center on Wellington Road. I did it. It came out that I had some prostate problem. But when I went back to doctor, I said, oh, no. Then we have to do some biopsy. They went, they did biopsy. And what is interesting, the biopsy was done in Uganda, sent to Coral Hospital, but was read, as they say, read in Ohio University, in Ohio Hospital in the USA. And I had only 2 days to come back. When Dr. Water saw the result, said, you need to get some medical attention as urgent as possible. That means I had to get surgery. I said, surgery? Mm-hmm. He said, no, don't take it seriously. You need to be done if you go to the States, make sure they cut out the surgery of your prostate. I said, okay. I called my family and I told them about what had happened to me. The first thing I had, oh, Ngakitaro, sorry. They were all in sombre mood. But for me, I didn't take it seriously until my sister talked to me about how serious the problem was. And another one who talked to me, who counseled me, not talking to me, I want to be very frank, was Dr. Christina. who counseled me and somehow gave me a preamble of preparing me of what I'll be going through. I went back, if I don't forget, it was a Thursday. And I was leaving by Friday evening. I went back in my house where I stay alone when I come to Uganda, and then started thinking about cancer. Now something came in. Cancer, prostate. What am I gonna be? I looked at it. I started thinking. Then I started Googling about it. As some fear started to come into my heart, into my body, feeling some fear of having cancer. But thank God, and I say thank God, that had counseled people with HIV and AIDS for quite a number of periods, for more than 10 years, while I was in Uganda. And I said, why not me? Why not me? That was a very bold statement that changed my way of thinking, my way of looking at cancer as a killer disease, my way of thinking of what cancer would do to me. I said, why not me? But it had not really sunk until I came here. When I came here, I saw my family were all anxious to meet me, especially one of my daughters, who is a nurse. He said, I don't take this thing lightly. This thing can kill you. We are going to lose you. I said, no, I will be all right. He said, Daddy, no, 19 is high. I said, no, I will be okay. But the bad thing was a good thing. I had no symptoms they talk of, like frequent urination. I never had anything like that. I was having normal urination once during the night, or 2-3 times during the day. I never had that sort of thing. I never had any pain. I was normal. But my daughter told me, yes, you are normal. Cancer will not give you pain. You get pain afterwards when it has reached a stage, but you are lucky you have got it now. So that is how I knew I had cancer. Now, some of the fears I had with this kind of thing is, how long am I going to live? How long? Because we all want to live. We want to go to heaven, but we don't want to die. So I said, oh, how long? And second, I said to look at my children, because I said, oh, am I going to die without seeing any grandkid? I was looking at the period of the agony I can go through, because I've seen people suffering with the cancer, not prostate, but other cancers, the agony they go through until they die. I said, am I going to be like that? The another one we had is they talk with solo that if you have some cancer and they remove your prostate, you are no longer a man. So how can I start walking? And they say, that he's not a man. I said, that's good. The ship knocked me down, but I have children, so I'm not important. That also gave me some kind of thing, but it is not easy, especially when the people surrounding you don't give you support. But for me, my family was the first pillar, was the first stone to give me support. They were always encouraging me, Daddy, you need to go and get treatment. Those were some of the challenges I had. But as I said earlier, it was Mike working with HIV people that also gave him more strength to live. But at some point, I want to be open, as I was said from the start. There are times I could go into my bed at night and I say, okay, how many am I going to live? And you could feel the tears coming out of the eyes as you think about it. But I said I will live and I will go through. Now, my problem here, what I went through was when I was diagnosed with this cancer, by that time, the insurance I had was not covering that treatment of cancer. So it was really, really difficult for me to have treatment that is cheaper in the USA. The cheapest hospital I went to is known as, it is a government hospital run by the state of Virginia. It is called the Commonwealth of Virginia Hospital, VCU. When I went there, the amount of money they told me, that was the least money they told me, was $119,000 to carry out that surgery. And they said if you can carry it out, then you can fill in the form for people, probably to get some people can help you or to cut down the cost. But that is the cost if you don't have insurance. So I said, I don't have that. But the good thing, never, and I'm telling people, if you have a problem, always discuss it with other people. They might have a solution for your problem. And as I was talking, discussing this, somewhere I talked to, there's one of my son called Eddie, you know Eddie Wanda. I talked to Eddie Wanda. You know, Eddie, I'm having a problem, ABCDE. I don't want to, I have prostate cancer, but I've gone to all hospitals. The money they told, the amount of money they want, I don't have it. He said, don't worry, don't worry. You know, your daughter, one of your daughters is working in NIH. NIH stands for National Institute of Health. It is a federal government hospital doing research on cancer. He said, I'll talk to her if they can take you on. But I'm not promising you. But the good thing, that daughter of yours is coming here. I'm calling him the daughter of mine. That was a sister-in-law of Eddie. So he's coming, she'll be coming here, but the weekend we'll talk about it. He came, they talked about it. He said, oh, no, Daddy, I know you. I will go and we'll talk about it with my people, the doctors and the team. Luckily enough, to cut the story short, they took me over. And I was happy, very happy. But I had to sign some documents with that hospital. And up to now, I'm a guinea pig. I call myself a guinea pig of prostate cancer in NIH. So I signed all the papers, and they took me off, but they were snug that they could not rely on the medical report I had from Uganda, though they were able to get the slides from Ohio. They could not rely on them until they make their own. Now, here is the problem I had. When they get them, they told me, now, we cannot do any biopsy on you until it is after 3 months. Because the blood is still there. the wound has not healed. We cannot do any test until it is after 3 months. I accepted. But when I talked to my sister who is in Kampala, I said, no, Tata, go anywhere. Because that cancer the cells have been touched, it can spread, blah, blah, blah. I said, I have nothing to do. Let me hope all will go well. They took me over. They found out, but for them, the PSA was not 19. They found the PSA was 14. So they diagnosed me. They prepared me very well. I'm telling you, they really prepared me, both physically, mentally, and socially. They really prepared me because you could go have a session with the different doctors until the final thing was done. Now, what are the experiences I have or the challenges I'm having after this kind of prostate I'm having? Physical, mental, and social. Well, that is also another problem people fear to talk about. I really, really appreciate Dr. Christine. He told me openly, he said, though you're going to get that surgery, one, don't think you at any point the urine will drop out. If you laugh, if you're in a flight mode, if you're moving around somehow, somewhere, prepare for that. Prepare to go back to be like a young born kid, meaning having a diaper on you all the time. That's a very big challenge. I'm sorry to talk about. It's a very big challenge. But if you know you have gone through, you have got, it has come, you just have to accept it and go with it. Two, another challenge was doing the exercise is known as, Dr. Christine, what is that exercise? I've forgotten the name of you do after they have, after the surgery. I've forgotten the name of that exercise you are supposed to do. Doctors, you can help me.
I think he's referring to robotic surgery where.
No, not robotic. There's an exercise you do.
Oh.
Is it Kegel?
Kegel exercises.
Yes.
Kegel.
Yeah. That one. That one, it is very, when they talk about it, you can do it every day, unless you discipline yourself. If you don't discipline yourself, you cannot do it as a doctor say. But as I told you, I had the support of my daughter. She would always call me, Daddy, have you done the Kegel? For how many minutes? Daddy, have you done the Kegel? That exercise is very good, but it is not easy to do it. That one is like that. So mentally, I have, as I tell you, at one time you can go into remorse because I had 2.5 years of going to for medical exams. Now I'm going there every 4 months. I go back. Why? Because my PSA had gone to 0. By the time they said now you're okay to go, but after 2 years of living, that about 4 years, it went back. Now it is 3. But they have tried to contain it. They have really, really tried to contain it by giving me different medication. I'm taking. It's not different. It's not different medication. They give me one medication. They give me every 3 months. Hello?
I think we are having some interference, but you can go on. We'll
Okay.
ask them to mute.
All right. So that one, I'm living with it. And whenever I tell people, whenever you get a surgery on you, your life will never be the same. It will never be the same. And the issue of saying you cannot have sexual relationship, sexual intimacy, the surgery I got, the robotic surgery I got, was so good that the so-called membrane, the doctors know it, was saved. It was saved, but they told me, and I don't want to since we are aging, they told me you are going to have now what they call dry sex. I accepted. I said, good, thank God. And I remember when I came out of the hospital with my wife, we came back because I was there with my wife and my daughter for 1 week. But my wife said, thank God, you had already have children. Now, I said, hey, for you about children, for me, I'm about intimacy. So,
Quite right. Sex is not all about children.
I said, okay, but thank God to go through that. And my children have been, and I say, my children and my wife have been a pillar to look healthy. People think I'm healthy, but inside me, I know what I'm fighting. It's because they have been on my side all the time, giving me support, talking to me, so I don't live and
Yes.
that has really helped me in this kind of disease. And what I want to tell people is that cancer is like another disease. It's bad, some of us, as I told in my introduction, we never got to know that we need to get this medical exams, reviews, either annually on ourselves. Because I remember I talked to my brother-in-law, my brother, whom they Nathan, who is now also retired. I talked to him, do it seems this disease might be genetic. I said, why? I said, okay. One of our brother died of prostate cancer. I've been diagnosed with it. I'm still living. You need to go and take a have a check yourself. He told me, Muganda, I don't want to hear that. Wait for the day it will come. So most people have that fear. And that fear still lives in most men. Some of them, the fear is having intimacy with their opposite sex. Some of them is how people are going to look at them. And some of them is how are they going to cope? Because coping is not also very easy. Is to change the habit, because I was reading through one of the slides we are talking about the habits, the way of life you are going to live. It's really not easy. Somebody tells you you have to be very active in doing exercises. We talk about exercises, we talk about it, but in reality, very few people really do real exercises, very few. And at times I'm a culprit. And I'm a culprit, and I laugh at myself because I have all the things I have here my garage is full of all machines for doing exercises. But at times I can take 3-4 days without doing an exercise. And it is now my grandkids say, no, Papa, let's go for exercise. Let's go for exercise. It is not easy. Wait, wait and eating is not also easy. Some of us enjoy meat. They say I have to decrease on meat. And now me, I want to tell you, I had another surgery of the gallbladder. It was removed. You doctors, you know about it. It was removed. So fat things, I have to leave it out. But if you keep yourself and live within the limits of your prescribed physician's advice, you can live longer. And don't fear, please, men, don't fear to get these tests. My only problem is the cost. Some people would like to go. I was talking to my uncle, one of my uncles in town, and he said, but I want to go. It is too expensive. Where am I going to get the money? It's expensive. As per Ugandan standard, it is expensive. But if not expensive, we should go for these tests and know where we stand. It helps a lot. Having said all that, aging, as they call it, people, purposeful aging, please, let's have these tests and don't fear. Talk to your spouse, talk to your children, get a friend you trust, discuss it with that friend. I tell you, you'll go through it. And when you're together, everything is good. Last but not least, because where I go to in the NIH, they have now put up a club for men who have been diagnosed with prostate because they have seen it is becoming a very big problem. We go there and we talk about our experiences, what we have gone through. You come out as if you have been in a meeting with the brethren from Kawempe. You say, you are somehow you are elevated.
Nigeria.
Elevated, go with a new way of living. That's how it is. That is, I've been told that now in Uganda, it is now becoming a bit cheaper. It is 100,000 to do that test. But for me, it was more than that. See, it has decreased a lot because to give you a preamble, to go for the MRI, I paid 800 plus. When I went to biopsy at Mengo Hospital, it was 900 plus. So, but when I'm hearing it's now 100,000, it has come down. Please don't hesitate. Money won't bother you. Money won't help you, but the money will save your life. Thank you. Any question?
Thank you so much, Reverend Kakonge. Thank you so much for sharing openly about cancer of the prostate. We've been touched. It's not only men, it involves all of us, women, children, grandchildren. We can all do there's a part for each one of us to play.
Yes.
Before I give this session to Dr. Philippa to run, I would like to know in this club of Kawempe, what other fears do those members have? Are they any different from yours? Are there special ones, or just tell us more about the fears they have and what they are doing? Because for you, you are lucky you had the background of counseling and working with people in such tight situations. How about those other Kawempe members, Nigeria members?
Thank you, Christine. Our club is interesting. One of the problem with that club, people who join that club are not people of social status. That is one. By social status, I mean they don't have money. Therefore, one of the fears they have is money. And most of them, some of them are doing what we say they are doing casual work. And by doing casual work, you have to move around from here to there. You have to lift things. And they say when they're lifting, their panties get wet and they feel ashamed. Like that one of the Sudani man, you know. So that is one of the fears, one of the challenges they are having, that at times they can't control the urine. And that makes them not go to work. Some of them said, well, I had 2 of them were saying, I have refused to go to work and I've now ended up asking for the government to give me some, we call it money, EBT card, to get food money from the government, because you can no longer to go to work because of that. Secondly, it all goes back to the economy they are having, is having constant supply of the diapers, because now they have really increased. I remember by the time, some 7 years ago, because of Douglas 217, now it is coming to some kind 8 years ago, my first box of diaper, I bought it at $12. But now, as I'm talking, a box of diaper, I'm buying it at $45. So it has really, really increased. So those are the problems.
45
Then
is a lot.
Then another fear they are having, which I haven't talked about, but now let me talk about. It had skipped my memory. You know, when you get this kind of surgery, and they save your money, in quotes, they save it, it will never go back. The strength will never go back as it was before. Somehow, you need it. That strength, if it doesn't go back, they say now our spouses are saying ABCD, we are no longer as good as we were before. They try to take some Viagra.
Yes.
For helping them, though it is prescribed by some doctors, because they gave different information. They gave me Viagra, but they gave me Viagra only for 2 months. But after that one, they said don't take it on a regular basis unless you feel so. But since then, I've never taken any Viagra. And I said to them that does not necessarily mean penetration. How do you handle? How do you romance? How do you feel? Don't put all your ideas into that kind of penetration. No, find other ways you can achieve what you want to achieve with your spouse in an amicable way. That's also their fear.
Thank you so much. Yes, can Dr. Philippa take on questions, comments, and answers, please?
All right, thank you very much, Reverend Kakonge, for sharing very openly with us. We really appreciate that. We have a few questions. I'll start with one which says, what can someone do to know if they have an enlarged prostate? I'm thinking maybe we can ask Dr. Makanga to help us answer this one. And then we'll give the ones for advice to Reverend. Dr. Makanga, can you help us answer the question? And what can someone do if they know they have an enlarged? What can someone do to know if they have an enlarged prostate?
Thank you so much, Purposeful Aging, and thank you, Dr. Philippa. Thank you so much, Reverend, for the testimony you've given. And yes, just to answer the question, how someone could know if they have an enlarged prostate. Number one, like Reverend said, this problem is strictly for men. So the number one risk for having a prostate problem is being born as a male. Now, that's number one. Number two is the age factor. The age factor, the prostate starts to enlarge from around the age of 45 or 50, majority probably above 50 years old. Sadly, like Reverend said, majority of the men will go unnoticed because they have no symptoms. And you all heard from Reverend, he actually had no symptoms. It was detected on routine examination. The others who will manifest with symptoms is the symptoms basically manifest because of the location of the prostate. The prostate is located in the area that we call the pelvic area, somewhere behind, if I'm to describe as a layman, behind the penile organ. Mm-hmm. It's a very small organ that within it runs what we call the urine tube, in medical terms that we call the urethra. So as it enlarges, you could imagine it will compress that urine flow. And because of that, one of the earliest manifestations will be problems to do with the urination. One of them could be what we call frequency. A man will start frequenting the washroom so many times a day, and many times the volumes or amounts of urine are very small. And then they also might have what we call urgency. So there's always a need to rush, and each time they rush to the washroom and empty their urine or bladder, after a few minutes they feel like there is some more left and they have to go back. Others will manifest with passing out urine many times in the night. Now, these symptoms could be symptoms for other conditions, but the prostate can also present like this. The others could be forceful urination, because the tube that transports the urine is partially blocked or sometimes completely blocked by the enlarged prostate. You're forcefully exerting pressure to pass out the urine. Sometimes if it's both cancer, but or the enlarged prostate, but many times cancer, then you might probably pass blood in urine or blood in your semen. And then others in the advanced stages, especially with cancer, it might come in with back problems, especially when you have the cancer has probably spread way beyond the prostate. I think these are some of the symptoms that we might look out for the men. But by and large, like, again, I will emphasize this, that most of these problems are detected on routine screening. And I think I like the message that Reverend sent out, that as men 45 and above, let's be keen on doing our annual or biannual checks and include the prostate tests in there. I don't know if I've answered that correctly, but maybe to add on, we back up these symptoms. So if you've had any of these symptoms, and then you go to the health worker, so they're going to do a kind of risk profile of you to see if you have any risks for the prostate enlargement or prostate cancer. There is still no scientific information to put a specific cause of why the prostate gets enlarged or why the prostate gets cancer. But there are particular, what we call risk factors that we look out for. And one of them, number one, like I said, is being male, being maybe 50 years and above, being black in terms of ethnicity, the blacks tend to have a lot more enlarged prostates and a lot more aggressive prostate cancer than our white counterparts. The others are things like obesity or overweight. Those are the other factors. And then the other important one that Reverend also touched on is family history of prostate cancer in one of the either father or grandfather or brother. Then the risk among the primary relatives will also be very high. The other I think that has come through is if there's a history in the family of breast cancer, particular breast cancers, then the risk of prostate cancer might also be high in the family. So as we're doing the assessment as doctors, those are some of the things we look at. Do you have a family history? Are you overweight and all that? Then we go ahead and maybe examine if you have those symptoms. And one of the examination is one that is quite uncomfortable for very many men, probably because of the culturally, because we have to examine that prostate gland, and how it's done is as a doctor will wear gloves and then lubricate a finger, and then we have to examine your prostate through your behind, and examine basically for the size, the consistency, to feel whether it is enlarged or not, and whether it's hard. So that also gives us a very good assessment. And once we feel that, then we go ahead and request for the tests. And one of them would be that the PSA test. It's in full, it is what called prostatic specific antigen. And this test, yes, so it's a test that looks for specific proteins that are produced by that prostate gland. And once it is high, it could mean 3 or 4 things. One, that the prostate could be enlarged, or it could be cancer, or it could be an infection of the prostate, could be an infection of the urine. So sometimes not all high PSAs directly point to cancer or enlarged prostate. It could be the other things. So we don't interpret it in isolation. So if it is high, together with the examination that I mentioned earlier, then we go ahead and do other tests like the scan, a simple scan that will also guide us on the appearance of the prostate. All the other sophisticated scans like the MRI scans and all that. And then many times we refer the patients to specialists called urologists, who will sometimes then ask for an additional test like what Reverend went through, the biopsy. And the biopsy is like the gold standard of differentiating whether it is ordinary enlargement of the prostate or it is cancerous. And if it is cancerous, then they will also go ahead and do lots and lots of tests on that biopsy to see, staging it, and also finding out whether it is the slow growing type or fast growing type, because there are some cancers that are really slow in progression. And very many men, like we've been told, have actually gone to their graves due to other causes at the ages of 100, not knowing that they had prostate cancer because they had probably the variant that is slow growing. And then there are those that where it is really fast growing. So the biopsy sometimes differentiates all that. And to some extent will also determine what kind of treatment you'll get. So I think maybe I'll stop there for now. I don't know if I answered or answered too much. Thank you.
Thank you very much for that elaborate answer. I think I'll go back now to Reverend. There's a question for you on what advice can you give to young people regarding prostate cancer?
Thank you. First of all, thank you, Dr. Makanga. You did so well. Advice to young. Now, here in the States now, because since I was diagnosed with this kind of cancer, I've taken a keen interest in reading some of the materials related to prostate cancer. Now, it has become advisable now in the States that don't wait for 40, 50 years. But as long as you clock 30 years, go and have that test. That is now in the States. I don't know what is in Uganda as of now. But the advice I'm giving one is to eat healthy. Obesity, we want it, but can cause a problem. 2, if they can be able to eat organic food, because as I said, when you go in our Kawempe club, organic food is so much emphasized. But the bad thing I am experiencing here is that organic food is expensive. We just have GMOs that are not expensive. But in my country, Uganda, it is easier to get organic food than where I am now. Another one is to take care of themselves health-wise, medically. When you feel, don't wait to feel that you are sick. They are in this, for them, the youth are privileged to be in a world where information can be easily shared. They look for information about how to live health, how to get treatment if I have this, how to get advice if I'm having ABCDE. That's the only thing I can give to the youth. They should not fear to get all this. Another thing, they should not fear that getting prostate cancer is the end of everything. No. If it comes, as I say, if it comes, first of all, is to accept. Times I have a problem with say, accept. It's not easy, but easier to say it, but it's not easy to take it. Accept it has come, it has come. Then start to bargain. And after bargaining, plan the way forward. And by planning the way forward is looking for assistance from a qualified medical person. You'll hear a lot. These days, we're having so many doctors in quotes. Eat this, take this will do this, this will do this, don't do this. You can get confused because everybody is now a doctor of cancer. I don't know if they experienced it, but whenever I'm reading on the internet, everybody is a doctor of cancer. So they have to be very careful. What are they choosing? If they're choosing it, I should request them to have some kind of guidance from a medical professional that they are saying ABCDE. If I do it, what are the results? What would be the effects if I do the ABCDE? So they go into something knowing what can happen. That's the only advice I can give.
Thank you very much. And since we are still in advice mode, I'd like you to give also some advice to family members. You mentioned that you had a lot of support from your family, which was very good for you. So can you maybe just list a few things, help family members, wives, children, to better support men, also given that you have the Kawempe group, things that they would like or they would find useful if they got from their family members?
Can you repeat the question to be more clear?
Okay, we're asking for some advice to family members.
Yes.
In terms of how they can better support men with prostate cancer, like what men would want and what they would consider as support from the family.
Okay. From a spouse, the first thing from a spouse is not to see you as the spouse who was a good spouse and was, I don't know, that you have not changed. For example, although there's a word we used to say in Uganda, it's okuyeya. And somebody explained to me that word in English, okuyeya.
Oh, yeah.
Hey,
That is like,
Stigmatization.
well,
okay.
okay.
That's a good one.
Let me take-
I hadn't thought of it. Stigmatization.
Okay. If you take somebody, yes, the spouse should always run away from stigmatizing another spouse, because that can create a problem. Because if you don't feel secure with your spouse, nothing will work out. The spouse should stand in for the man. The woman should stand in for the man to make him feel that he is a man, though he has got a prostate. You know, men want to feel like we're men. That is an instinct within us. For the kid, for the children, the support they have is to check on, just to check, how are you feeling? Have you been able to do this? Have you taken medication? Have you done exercises? What are you eating today? That kind of advice coming from, that kind of encouragement coming from your children will help you. Because I would say, for example, personally, Sarah, some of you know my daughter Sarah. Sarah will call you and will make sure, if you tell me, they told me to do ABCD. He said, okay, that's good, Daddy. But he'll make sure he's going to do a follow-up. Daddy, have you done ABCD? They told you to do this. Have you done it? At times, you could feel he's on your neck, but he's helping you to get used with what they told you to do. Because now, these days, they're saying, Daddy, the exercise we are doing is not enough. You need to do more exercises. They are not enough. And I feel they are not enough. So that's kind of encouragement. The children are giving you. They say, no, Daddy. Personally, I enjoy eating meat. That one I cannot say. I say it openly. I enjoy eating meat.
You are right.
And
But
but now they made a timetable for me for the week to eat meat. And I accepted. I have nothing to do. So that's what I am.
Right, thank you. I'm still laughing at the timetable for meat.
Yes.
Very interesting. Yes, thank you for that advice, especially the one for the spouse, because I think it's a good thing for men, that's the spouse, the men, to feel like they're still men.
Mm.
It's a long way. Right. There's a similar question before we leave that advice. Whether did you have any counseling sessions that included your spouse? Is it important to do couple counseling, especially regarding sex?
Yes. I think I omitted it. In the 4 days prior to the surgery, they wanted to come with either your spouse or your child, whom you think can sign it for me. But from what I asked them to come with with 2 of them. So I went with Sarah and Mary. They went together. And they go through. First of all, they tell them what I am going to experience, and for them not to get shocked. But when they were counseling, when my daughter was replying to them into medical terms. And I said, "Whoa, are you a medical doctor?" He said, "No, but I'm not a medical doctor. I'm just a medical professional." He said, "Yeah, the way you're answering, you'll help your mother very well." So in a nutshell, they will never do such counseling. If you're married, they want the counseling done with your wife.
Right. Thank you very much for that. there's been some appreciation in the chat for this nice session. And thank you, Christine, for bringing out the point of doing a similar session for breast cancer. There was a session we had last year in November, which is also on our YouTube channel. And it was talking about cancer generally, but the speaker was a breast cancer survivor. It may be useful for you to look at that video recording to get some tips on how to handle. But we can have in future a session specifically for breast cancer for women to learn. Thank you for that, Christine. Someone asked about where to go for treatment for prostate cancer, and there have been answers in the chat, including Uganda Cancer Institute, Mbarara Regional Referral, and many other regional hospitals, as well as private hospitals like Surgeons Plaza, where Dr. Kagwa is, Dr. Watia at Eurocare in Nansana. And most private hospitals, at least you get some care to start off. I hope that answers your question about care, Nina. And there was another one for Reverend. Sorry, no, I think, no, sorry, it's not for Reverend. It is for Dr. Javia. Is there a relationship between men's extended abdomen and an enlarged prostate? Dr. Javia, can you come in to answer that one briefly before I take a question from Josephine?
Thank you for that question. Maybe just before I answer that one, in 2 seconds, let me just add on to about where people can get the care. Now, like Reverend said, managing cancer of the prostate is not a one-man show, especially with the healthcare worker. It's teamwork. So it's with your primary doctor, and the different specialists. So we have what we call the urologists. Those are the ones who will probably follow you up in terms of the surgical care. But we also have the cancer doctors who you'll find many times at Uganda Cancer Institute and a few other private hospitals. And then you have other specialists depending on the complications that the prostate cancer led to. So it's teamwork, and then the counselors, and then family, like Reverend has also alluded to. So it's a whole, because of the nature of what cancer causes in terms of mental, social, and all that, physical, it's basically teamwork. And you'll find all these people in these particular hospitals. Now, going back to this other question of, I think it was a big abdomen and prostate cancer, there is a relationship, but not exactly a cause, if I'm to put it that way. One of the risk factors for enlarged prostate or prostate cancer is obesity. Now, obesity or overweight. Now, the enlarged abdomen many times is a marker of when we usually, the medical term will be, we take what we call the waist circumference, and there's a cutoff for both women and men. And if you're beyond that cutoff, then your risk factors for not just prostate cancer, but for other diseases like high blood pressure, diabetes, and many other cancers, including strokes, including dementia, are all increased by so many fold. So yes, there is a kind of correlation between that increased abdominal size and cancers. So I will lump it up into cancers, and there are very many, including cancer of the breast, cancer of the colon, cancer of the prostate, and I think which other, a few other cancers that are probably are off my head. But yes, you are right. There is that correlation, not a cause, but there is a risk. Thank you.
Thank you very much for that. Josephine, your hand is up. You can unmute and voice over.
Good morning.
Josephine.
Thank you for the presentation. I am actually a urologist, but I also have a father who has prostate cancer, and that was one of the reasons why I checked into this presentation. Now, I just wanted to echo a few things that the Reverend talked about. Reverend was asked a question about some of the risks, and Dr. Makanga came in and talked about the age and ethnicity. The Reverend was asked something about genetics. Genetics is one of the high risk factors for prostate cancer, not BPH, the enlarged prostate, but prostate cancer per se. So usually when you have a family member, especially a close family member, we call it first degree or second degree. If it's a father, a brother who has prostate cancer, you would encourage your relatives, your immediate relatives, to go for screening early. And I'm happy with the Reverend when he talked about the routine screening. We do encourage it, especially for our ethnicity, the Blacks. The earlier the cancer is caught, the better. I'm not sure what Reverend's stage was, but usually the early stages are easier to manage before the complications come in. One of the reasons I wanted to hear, of course, for me as a person who has a member who has prostate cancer, I wanted to know how family was helped, but I'm glad he talked about it, and I wanted to also find out about counseling. I would like to hear from Dr. Makanga if they give counseling to such patients in our setting. Generally, the care which I know of where people can be managed, especially free of charge, is Uganda Cancer Institute. It's the patient can be managed from the time they come in for screening, for the surgical management, and even there are other modes of management like radiation therapy, chemotherapy, especially for advanced prostate cancer disease. Thank you very much.
Okay, thank you very much, Josephine. It is nice to have had you on the session, and thank you for your input. Dr. Makanga, do you want to talk about the question she posed to you on family support in Uganda?
Thank you so much, Dr. Josephine. Now, I need to put a caveat here. I'm not a cancer specialist, but at least I have worked closely with some of my colleagues that involved in this area. What I know is that Cancer Institute, I think runs or works in association with a few NGOs. I think some of them are cancer surviving, is it Cancer Survivors Organization, something like that, I'm not sure. And that organization, I think, gives some kind of emotional and social and psychosocial support to cancer patients and those with ongoing treatment, and also to the families. I don't have the details about that, but I know it's going on. And then a few hospitals, both the non-for-profit, I think also might probably be having some of these programs. So there is, I think, some programs going on, but I think they are overwhelmed by the numbers, and especially at Cancer Institute. If a few of you who have gone there lately, you'll be surprised at the numbers that they have there. So I'm not sure how the program is working, but I know it does exist. Thank you.
Okay, thank you for that. I think in addition to that,
Dr. Philippa,
yes.
I just wanted to put in a word on the counseling.
Mhm.
I've had a lot of, I'm also putting a disclaimer, I'm not even practicing medicine now, but I've had many relatives with CA prostate and many friends. One thing which I want to highlight is that our brothers and husbands and friends and whatever do not want to talk about this, do not even want to go for examination. So there's a group, there's a Bufunda type of group, Kawempe Nigeria group, which was connected to Nairobi Hospital. simply because there was a surgeon who used to fly in here and work on people's prostates. That group used to have, you know, counseling and support to the various members of that club who had cancer of the prostate. It was informal and I think died with COVID-19. So there is a big gap in counseling. We need to help out. We need to encourage our brothers and whatever to really come to these Kawempe Nigeria groups to help each other.
Right, thank you for that. In addition, Uganda Cancer Institute, there's a counselor stroke nurse who we hosted in November. I can give you her contact, Josephine, and if you could possibly, they do psychosocial support for the patient and family, and it could be a good start for you. I see a hand from Gadi, but please allow me to first deal with a question in the chat that's been there for a while, which I think is important, especially since we have talked about men not going for these tests. It's a question to you, Reverend, and it is, how do you deal with entondo, for lack of the English word, but I'm sure, Reverend, you understand what entondo is. How do you deal with entondo patients? With entondo, patients develop with chronic illness. Thank you, Reverend, for that testimony and presentation.
Yes.
Yeah.
The
Yes,
word
the
entondo,
question is,
it's not easy throughout my work as a counselor. Somebody who has that kind of behavior, that kind of attitude, it's an attitude, not a behavior. It's an attitude. You need to take time for him to accept the situation, because that kind of attitude comes if you don't accept, if you don't really understand the situation you're going through, or if you think that God doesn't love you, or if you think that some people are doing it better because for you are sick. So dealing with somebody with that attitude needs patience. You have to be very patient, but at the same time, you have to give him all the information you have at your disposal and encourage him to participate, to be open and participate in some activities. Say it could be in Tondo because I'm having prostate, I can't do this. I'm having prostate, I can't say do some kind of work because I'm drippy, I'm having some drips. No, you say no, you can't do it. Always somebody who is near that person must always show positivity, must always encourage and let him also see that that's the best thing you can do. Instead of sitting back and you say, the more you sit back, the more that attitude becomes another problem too, to you, and can lead you to do something bad or to do something worse than you would have done, than you wouldn't have done if you were open up. So it's a bit tricky. Depends on the situation, that's one. Depends on the person, and also depends on how he perceives you, somebody who's talking to, because they can perceive you as if he speaks like that because he's okay. So there's that kind of empathy that comes in while you're talking to this kind of person. It is not easy. That's what I can say.
right. Thank you for that. I think the family support and counseling would also be very helpful to help members get that patience and empathy. Right. Gad, you had your hand up. Do you want to unmute and voice over now?
Okay. Yes, thank you very much, moderator, and thank you very much, Reverend, for that excellent exposition. I happen to be one of the people who have gone through all this process, and I'm coping very well. But there is one in the treatment process. There is an injection which is extremely expensive, and I think that has become an issue for most people. If they don't get it from a government hospital where it is free, that injection goes for 800,000 plus. First of all, I wanted if any of the doctors on the panel or who are listening in can explain the importance of that injection, so that people don't miss it out because it's expensive and end up not getting the full treatment. That injection is actually injected on the stomach. Thank you.
Okay, Dr. Makanga, can you help us answer that question?
Thank you, Mr. Is it Gadi? Yes, you're right. And again, I'm going to speak because my area of specialty is I'm a kidney specialist and not a cancer specialist. But like I said, I have worked with a few of my colleagues where I refer patients with prostate cancer. Now, that injection, I think you're referring to an injection called Zoladex. And so I'll try to probably be as non-medical as possible. One of the drivers of growth of the prostate cancer is our male hormone, the testosterone hormone, the one that makes us men. Now that injection, the Zoladex, basically inhibits or prevents or reduces the levels of testosterone, and in so doing, it kind of slows down the growth of the cancer cells. And in some men, I'm sure many of you have heard, in some of the other treatment modalities, in some centers, what they've done is that they've actually done castration of the men. And one of the reasons is actually to kind of take away that driver, that testosterone. Now, in modern science these days, I think Dr. Josephine probably hinted to it a little. There's what they call precision medicine. And precision medicine here means they treat your cancer with precision, meaning they're going to type your cancer, because not all men, for example, might respond to that injection Zoladex. So what they do in some cancers, they will actually go up to your genetic level and see what kind of genetic, they basically profile you based on your genes. And then they target the treatment based on your individual genetic makeup. That's where medicine has reached. So in some of those advanced centers, and I think even at Cancer Institute, they are trying to do that, to genetically profile you and give you specific targeted treatments. If it is what we call, if you're going that direction of what we call the hormonal treatment modality, because the treatment profiles probably were not talked about in detail, because the treatments could be chemotherapy, meaning you're using drugs. It could be, and the drugs could include hormones. The other could be surgery, like Reverend underwent. The others could be radiation. And radiation has also got different kinds of modalities these days. But coming back to these other newer methods that Mr. Gadi is talking about, the injection, the hormonal methods, it kind of slows the progression, but sometimes it's given in combination with other medications, or in combination with radiotherapy, or in combination with, it depends on what the cancer specialist has worked up or has profiled you. I don't know if I answer you well, Mr. Gadi.
Okay, thank you. Dr. Josephine, if you're still online and have anything to add, you can unmute and voice over.
Thank you. I think Dr. Makanga has tried
I'm not
as
sure
much
if
as
she's still online.
Man
But
is
if not, I see we have run out of time.
Hello.
Oh, she's on? Okay, please go ahead, Josephine.
I was saying Dr. Makanga has mentioned most of it. The only thing is maybe I want to add is at Cancer Institute, for those who are finding it hard, especially financially to find, Cancer Institute, this injection is given free of charge. The only challenge is sometimes it's available, sometimes it may not be available. Sometimes I work in Cancer Institute, so I know that most of the time, for the patients who are fit for that injection, have been getting it free of charge from Uganda Cancer Institute.
Right, that's good information. Thank you for that, Josephine. I'd like to hand back to you, moderator, given that we have now gone past our time. Yes, back to you.
Thank you so much, Dr. Philippa, for that session. It's like been a bit overwhelming. This morning, we thought we would not go into the medical side, but obviously we need to enlighten ourselves more on the diagnosis and treatment. But all the same, Dr. Makanga, is it Josephine? Thank you so much for the additions you've given. We had somehow Darlene at joining in. We thought he would give us a bit of overview from the other side of the continent about this whole cancer of the prostate, but I think he has gone off now. I wanted also to encourage the young among us who are still in 40s and 50 to actually go and do the PSA, spare that 50,000 and do it. And when you do it, do not just throw away the good results if it's still low. Keep it, and if possible, make a graph of it. The minute you see it rising this time, and the next 6 months it has risen, and the next 6 months it has risen, please go and insist with your doctor, the primary doctor, that you want to go for further tests on your prostate. I think this is the only way we can detect it as early as possible. I must confess, I've had a friend who has gone through routine tests for over 10 years and was persistently clear or below 2, only to find that all along changes had already started of cancerous growth, and the PSA had not risen to that much. So the warning these days is that a rising PSA, don't just sit back. You are still young. You have many, many, many years of very good sex ahead of you. Sex is the biggest fear men have. So do go have the PSA done and keep the figures. Watch out if they are rising, then you'll be good to go. Thank you, participants. We want to announce that the next session at the end of June will be on menopause, and it will be online. Please join in on that end of the last Saturday of the month, 10 o'clock. And for those who have missed or who would like to review past sessions, they are all available on YouTube. Please check on that, because you'll be able to link many of these topics together: obesity, nutrition. We've gone through all this, exercise, and how they help you to purposefully age. finally, Reverend Kakonge and family, thank you so much. We know it's been very early in the night for you. Please, now you can go and take a nap, but we are very, very grateful for your sharing, for all the wisdom and tips you've given us. Thank you so much. And bye-bye to all of you.